Thank you, everybody. Thank you, Jennifer, for having me. And hello, everybody out there. Welcome to Penn State. I am the subject librarian for political science, policy studies, and government information. Jen looped me in a couple years ago on the public health preparedness option in Homeland Security. And so I did a webinar last year about literature reviews and some of our resources and some of our services, and then some specific resources for public health preparedness, disaster medicine, and there's a number of other things in that realm. What I was able to do between last year and this year was create actually a custom guide specifically for you all, the students in the PHP option of Homeland Security. So I will show you that guide at some point in time during my presentation, and ask you to spend some time with that guide. It is by no means exhaustive, but it's an excellent resource. And it's so new that it's not linked from the library's website. So I'll share the link to the guide through the chat here tonight before I'm done. So, okay, so I'm going to share my screen and open up the library's main page. Just bear with me here just one moment.
So when Andrew's doing that, if you've got a question during the course of his presentation, you can either raise your hand in the participant window, and I can cut in and call on you, so that way you can ask it verbally if you want, or I will keep monitoring the chat while he's talking, so feel free to type it in there as well.
And that's great. Thank you, Jennifer. And yeah, and feel free to ask at any point in time that you have a question. Please feel free to ask. We can stop. Oftentimes more than one person has the same question. I try not to cover too much information in one session, and I'm going to encourage you all to spend some time with these resources on your own. So does everybody, can everyone hear me okay? Is that, okay. And so
Yep.
All right, thank you. So I'm sharing the library's main page. It's libraries.psu.edu. And if you, if you guys want to follow along and do this on your own, you're more than welcome to do that. Libraries.psu.edu. That's our common gateway to pretty much everything that we have access to through the university libraries. University Libraries is a top 10 research library in the world. So we have a tremendous amount of information available through the library website, whether it's access to print books that are still sitting on the shelves, to any number of our specialized databases, and then a number of our guides and services and beyond. So I can't cover everything. I would encourage everybody to spend some time with libraries.psu.edu. In fact, bookmark it on your computer, on your laptop, and have that as your go-to. The library's main page, at the very front and center of the main page, is this find box, and this find box is set up to find books, articles, and more. And it's actually set up to open up, it offers this search screen in front of you. And this is what some people refer to as Lion Search. It is our federated search. This search in front of you searches multiple databases at the same time, and then clumps the results by like material. So journal articles, books and media, and then newspapers. And I'm going to do a search, and I'm going to show you what that looks like. The federated search, probably searches about 85% of the databases that we have access to. It can vary. I like it because it's a great place to kind of build pieces of a foundation for a literature review. And it's also a great place to kind of study the landscape of the literature, is the terminology that I use, to kind of get a sense for what's being written about the topic that you're looking for. So what I'll do this evening is I'm going to spend some time thinking about building a literature review, thinking about, finding literature on a particular topic. And then what I'm going to do is I'm going to get into the guide that I created and show you some of those specific resources through the guide as well. So below the federated search, before I go ahead and do that search, there's a number of other things to pay attention to from the library's main page. Subject specialists, there are probably about 65 different subject specialists throughout the university libraries, and there's a possibility that you may be working on a project that is it may be better suited for another subject specialist other than I, whether it be nursing or agriculture specialists. There's a number of different specialists. So that's something to consider. In addition to that, we have a number of different guides. We have databases, subject guides, and course guides. The public health preparedness guide that I've created for this particular program will eventually be listed under subject guides. And then I believe it's going to be under social science and law. And what you can see here is a number of guides that fall under social science and law. And just to show you an example of, I don't think it's listed under, oh yeah, it's already there. So what the guides look like. All the guides are going to look very similar to this. They're going to have our banner across the top and links back to our resources. And then on the left-hand side, you're going to see different tabs that are going to link to specific sections of the guide. So I've set this guide up: books, databases, government information, gray literature, data resources, and then organizations. Every guide, regardless of the subject specialist, is going to have contact information. So you're going to see my information there. You're going to have my email, and then you're also on the opportunity to schedule an appointment with me automatically through the system. So I have a very brief overview of public health preparedness, and then and what I'm going to do is I'm going to come back to this particular guide in just a moment. But I want to get into some literature searching. But I wanted to show you what a guide looks like. If you were to click on the government information guide, it's going to look just like this particular guide as well. So I'm going to go back to the library's main page, and what I want to do is I want to show you the federated search. The federated search is not the only place that you should be looking for literature and to build a literature review from the library's resources, but it's one place that I like to kind of I like to use myself, and I like to show students the kind of the landscape of what's available to them. So in this particular, so if we go to the federated search, I'm going to do a search for Ebola and preparedness. And again, this is the federated search. It's searching multiple databases at the same time. We're not just searching medicine or public health databases. We're searching databases across the spectrum. The way that the federated search displays results initially is in this kind of boxed format. So you've got journal articles on the left, and it gives us an approximate number. These numbers are all approximate. But books and media, it gives us on the right. And then the and then another section, it searches our website as well. But most, the three most important are the journals, the books, and then the news and magazine articles. And so it separates those resources by the type of resource. So in order for these particular resources to be functional, for us to be able to start looking at them in their entirety, or at least the list, we have to click on the See All results. So what I want to do is I want to click on the See All results for this particular search for the journal articles. And I'm going to come back to the books and media because I think it's important. And so what Lion Search or the federated search does from the main page, once you click on those See All results, is it loads that entire list. and like I said, it's sometimes the numbers don't completely add up. Sometimes it has to do with authentication, and there's a number of things. It's pulling from multiple databases at the same time. But there's a number of things that you can do here to kind of make this particular set of resources work for you, so you can start saving resources so they're available to you to start reading, to start organizing, exporting. There's a number of things that you can do as far as limiting your search. We could go up to this particular box and add another term, and we might do that here before too long. And we can also go over here and look at the scholarly peer review and do that limiter. At this rate, I don't usually do those types of limiters. I start to really look at the resources to get a sense for what's available. In addition to that, one of the important things that I like to convey when I have this federated search open, and what I'll do is I'll open up a detailed record. If you click on the preview, then what it does is it loads the abstract. So one of the things that I like to talk about when we have these results in front of us, and this could be for the federated search, it could be for a specialized database, it could be for Google Scholar, it could be for a number of different things. You know, what I'm doing is I'm looking at titles, I'm looking at abstracts, I'm looking down below this abstract, I'm looking at the subject headings here, and I'm trying to get a sense for all of the language that relates to my search, and I'm trying to get a sense for people, places, events, leads that are going to lead me to more information or lead me to better terminology that's going to lead me to that information. So, you know, when I'm doing this initial search, it's really about kind of coming back to that idea of the landscape of the literature. It's really about kind of understanding what's being written about my topic. Is it coming from academic literature? Is it coming from government information or gray literature, or a number of different organizations and sources? And so those are the types of things that, you know, that I'm looking for here. Now, by all means, when I find an article, I'm going to save it and come back to it. So this particular article here, you know, I'm interested in Ebola and the preparedness for perhaps the next Ebola outbreak, or lessons learned from the last Ebola outbreak. So this particular article here, surveillance training for Ebola preparedness in Cote d'Ivoire, Guinea-Bissau, Senegal, and Mali from emerging infectious diseases, December 2017. And what this article explains, the 2014-15 epidemic of Ebola affected, right? So, you know, if I'm interested in preparedness in Ebola, and surveillance training, you know, this STEP initiative, you know, this should go on a reading list, right? And so, you know, I don't have to read very far to know that this is something that I should save. So one of, you know, the way that I do this in the federated search is if you look at these links to the right of the article, there's a permalink, cite this item, email this item, or save this item. And so I'm going to move my screen down. And when I click on this folder here, it turns red, and if you notice, the folder up here on the right turns to 1. So it's just like we're adding something to our cart on when we're online shopping. So we've saved this article, and so we can look at it at the end of our session, or manipulate it in some way, and I'll show you how to do that. So what I want to do is I want to go down. Note the subject headings here. It actually mentions that STEP program. You know, there's really no, you know, surveillance, Ebola. Those are both, you know, subject headings. You know, we could limit this search to Ebola and field-based training, perhaps. You know, there's a number of things that we could do. Just thinking about the subject headings for this particular article. I'm going to look at record number 2 here. Challenges to Ebola preparedness during an ongoing outbreak. An analysis of borderlands, livelihood, and trust. And so this looks like it's a little bit more detailed than the last. In the Congo, public health emergency of international concern, July 17th, 2019. So this is the more recent one. Okay, so looks like they're talking about some surveillance. And, you know, distrust in local communities. And I would say that this, although this article here is a little bit more specialized, I would say that if you're, what we're finding here is I search for Ebola and preparedness, but what I'm finding, or at least for the first two articles, is in the title, Ebola preparedness is actually a phrase. So any article that mentions Ebola preparedness, I think, should go on a reading list. So I'm going to save that article as well. I think about the subject headings. Ebola virus is a subject heading. So one thing that you can do when you're in this federated search is I can follow this subject heading link. And if you'll notice, it changes my search completely. And I'm looking for Ebola virus only in that subject field, but no longer the word preparedness. So if you'll notice, that actually broadened our search. And that doesn't surprise me, because preparedness is really a term that speaks speaks to many levels as far as what we're looking for. Where Ebola virus, this could be, in the first record there says it all: molecular evidence of sexual transmission of Ebola virus. So highly specialized. But that's something that you can do. And then one of the things we could do now is add preparedness on this search, but only Ebola virus in the subject heading. And so I would expect that to produce less than what we started with initially. And you can see that it did that. So, so if we look at record number 2 from a veterinary journal, I didn't want to do that. I wanted to look at the preview. Right, so this gets us into, where Ebola is always going to show up down here in the subject heading, where before we were scanning anywhere in the entire record for Ebola, and not specifically Ebola virus, although that's implied. So, but one of the things that you can do as you change this search, if we see our article, so if I add a couple more here, if we see the articles that we found earlier, it will recognize that they're in the folder, and it will add them to the folder. So so in this in this type of we're legal preparedness and Ebola vaccine. So that's a whole other kind of idea. But again, looking at an article like this from Lancet 2015, but think about the leads that you're seeing when you have these articles in front of you, and we're not even looking at the entire article. We're just looking at some summary information up here, and then the abstract here. And so those are in the U.S. Public Readiness and Emergency Preparedness Act. So there's leads that you want to kind of think about when you have these articles in front of you. And so that's kind of the main my main point when I'm scanning these particular articles. This one here, Ebola Preparedness: A Personal Perspective, the Journal of Hospital Infection. So this is interesting, because this is somebody's it's going to be somebody talking about their personal experience with with Ebola, and so we can add that to our list. A number of things, some other things to pay attention to on these particular records, and this is a federated search, so it's looking at multiple databases at the same time, but oftentimes what the federated search will tell us where this particular source came from. So this particular article, Journal of Hospital Infection, is indexed in Medline, and that doesn't surprise me. This particular topic is going to produce a lot of material from Medline, because that's where probably the most coverage is going to be. But at the same time, I like the federated search, because it crosses disciplines, and I think sometimes that's important. And if you pay attention over here to, on the left-hand side, you can actually limit to, only the public health journals, only medicine journals, biology, social welfare, and social work journals in the sciences. And then the subject terms, we can also look at that. The other thing you can do is you can look at publication date limiters over here. And then you can, if I click on this scholarly peer review, that's going to take that down to 374. But I guess this is a good time to introduce the idea of gray literature. And I'm not sure of everyone's familiarity with gray literature, but gray literature is this, and especially important for public health information. Gray literature is the vast, is a tremendous amount of information that's not produced by commercial publishers. It's produced by governments, organizations, universities, dissertations, things like that. And a lot of public health information does not come from commercial providers. So this gray literature, and it's indexed in Medline, and it's indexed in a place called Disaster Lit, which is a subset of Medline, and I'll show you that in a moment. And there's a number of resources in our federated search that's going to, when you do that scholarly peer review limiter, you may be eliminating some gray literature. You also may be eliminating some commercial trade types of journals that may be helpful and may not be helpful, but those are things to think about. I usually do not do the scholarly peer reviewed limiter at first, and especially for something related to public health, and in knowing that gray literature is a big part of that field, I usually don't do that scholarly peer reviewed limiter initially. Okay, so the I would probably, normally I would, I wanted to show you some of the functionality of the federated search. If I were truly looking for information on Ebola and preparedness, I probably would go back to my initial search and really start to scan those in first 30 to 50 articles and build my bibliography up. Once we have a collection from this particular resource, one of the, so what you can do is when you go up to this particular folder here, and you can see that I've saved 4 items. And, I work with the students in the counterterrorism option of the Homeland Security program. Sorry. And I work with those students on their capstones. And so they're all doing pretty extensive literature reviews. And so a search that we just did, I normally, and again, just Ebola and preparedness in the federated search, I'm never intimidated by the amount of results we found. I think there were 4,000 or 5,000 results for Ebola and preparedness. As a rule, I usually scan the first 30 to 50. Most likely you're going to save, maybe 20 of those articles because they're going to be right in line. And so, those are the articles then that you can start to sift through. Do I read I read the best 5, I save the worst 5 for later, and I think about the other 10. I start to look at the bibliographies of those articles that I found, the very best articles. I start to spend time with those bibliographies. In some cases, the bibliography of a particular article is going to be as valuable or more valuable than the article itself. So those are the types of things, for the sake of demonstration, I'm going to stop at 4. But, if I were really digging into Ebola and preparedness and I was going to do a scholarly lit review on that particular topic, I would have probably stuck with my original search and probably dug in a little bit and spent some time with those resources, reading the abstracts, learning the subject headings, and so on. So in order to get this information to yourself, or to manipulate it, as shown, you can export this. You can export it as shown. You can export it into particular styles, or you can export it to something called Zotero or EndNote. And that's, I guess that's my opportunity to talk about citation management software. Is anyone familiar with citation management software? EndNote, Zotero, or Mendeley?
Yeah, I use Mendeley.
And that's okay. Yeah, and so one of the things at some point in time, if you end up with a systematic review, or depending on a large research project, most undergrads even and graduate students are utilizing some sort of it's basically a plug-in for your browser, and it helps you when you're in a database. It helps you manage these resources, so you could and it helps you cite them easier and helps you keep track of them, and it's it's a time saver. So you can, when I get to the end of my presentation, there's some webinars coming up that the library is offering. I don't know if there's one on Zotero, but there's definitely one on Mendeley. My recommendation is Zotero. There's lots of free information out there on Zotero. It's a free plugin. It's fairly intuitive and easy to use. So that's kind of my kind of plug for a citation management software. Normally what I do is I'll just email this information. And so what you can do is you can set up an email, and then presumably you'll hear my email cling come in. So, yep, there it is. So that's the very kind of, that's a great way to start to build a bibliography. It's not complete. It's not the be all end all. When I work with the Capstone students in Homeland Security, we generally will search Google Scholar as well, and it will, both of these resources will produce different some unique results. And then there's some other specialized databases. And so let me take that opportunity. If anyone has any questions on the Federated Search, please feel free to put them in the chat, or reach out to me after the session. Okay, so I'm going to pull up the guide. Now I'm going to go to the guide, and I'm going to kind of get into some specific resources. And so what I've done here is I'm going to go back to my Lion search, and I'm going to go back to the library's main page. What I've done here with the Public Health Preparedness Guide is I've gone into the databases A to Z, and I've collected all of the databases that relate to public health preparedness, disaster medicine, and so on. But I've also included a number of other databases that are going to be gray literature databases that are offered from government resources or organizational resources. So, this is kind of this is a custom guide. Again, it's not exhaustive, but it's a, bookmark this guide, spend some time with this guide. If you find a great resource that should be on this guide, please feel free to email me, and I would love to include those resources. I would love for this to be something that we could build together from where it is now. So I've provided some background information here. Some of you might be aware of all of these ideas or cycles of public health preparedness. But I've included them as an overview for someone who might not be familiar with public health preparedness, who comes to this guide. So that's why I've kind of included that overview. Books, the books section of the guide is it links to our catalog. It links to a database called WorldCat, which is a catalog of libraries worldwide. And then I've actually linked some selected resources related to, public health preparedness overall. One of the things that I didn't do when I had the Federated Search open was show you the books and media and the newspaper articles. And so that's where, and when I look at this library catalog link, and I'm going to do that, I'm going to click on the library catalog link. And when you do a federated search, and I'll show you what this, so this is our library catalog. This is, this is our collection of books, media, government documents, and all kinds of other information that's not journals that are listed in the catalog. And for your program, a number of resources in our catalog are going to be very helpful. If I go back to the federated search from the main page, and I go to books and articles, and I'm going to do Ebola and preparedness again. Oh, I'm sorry. Pardon me here. I'm going to pull this federated search up. And if you notice, we looked at the journal articles. And this, the books and media here, when you click on the see all results for books and media, it takes you directly to our catalog. So from the Public Health Preparedness Guide, I've given you a direct link to the catalog, which when you jump to the catalog looks like this without a search. And so if we would do a search for Ebola and preparedness, it's going to be the same search that the federated search did essentially. Right, so we're looking at the same list. So you can do that in different ways. But the most important thing is thinking about what you're going to find in the catalog results. I'm the government information specialist for the university library, so I'm going to plug government documents. And here's detailed hospital checklist for Ebola preparedness. It's a government document from the HHS, and you can see. So if we click on this detailed record here, it loads that catalog record. It provides us subject headings just like the journal resources, and then it provides us this access. So oftentimes for government information, you're going to see this Perl FDLP.gov link, and that's going to take you directly to that document. And so, direct from our, so we started with the federated search, jumped into the catalog, and now we're looking at a government document from, that we've decided that we've cataloged, part of the Federal Depository Library Program, something we thought was important to catalog. So if I go back to the catalog, you can see it breaks it down by access. If we open up format, it breaks it down by government documents or just books. So if you didn't want to look at government documents and we just looked at just the books, oh, there it is. And so this is going to be, these are going to eliminate the hearings and the things from the CDC and perhaps be more academic in nature. Not that other information is not that government documents or government information is not important, but if you wanted to this is a different perspective because it's not, the government documents are going to flood this type of search because there's so much. And so that type of thing can be helpful. Okay, so if I go, all right, so if, if we wanted to look at libraries worldwide, we could go into WorldCat, and again, some of these selected books. But I would encourage everybody to spend some time with Lion Search, spend some time with the library catalog. The more time you spend with these resources, the better off, the better you'll get at using them and thinking about how to get the most out of them. If I click on the Databases tab for the guide, okay, so I've linked PubMed, CAB abstracts. There's a section of CAB abstracts, mostly agriculture, nutrition, but there's a global health section of CAB abstracts I thought was important to include. Google Scholar. Google Scholar searches the scholarly slice of the internet using the Google search engine. I'm sure some of you or all of you are familiar with Google Scholar. I use Google Scholar in tandem with Lion Search and then specialized databases depending on the type of information I'm after, right? So ToxLine, and then what I've done at the bottom, Toxicology Abstracts, ToxLine, and there are probably some others, and what I've done is I've provided a link at the bottom of the databases back to our A to Z list to look at the exhaustive list. If I go into Medline, and when you jump from any of the resources from my guide, it's going to open up a separate window, so you always have the guide available to you. And it's going to ask me to authenticate. And I don't think I'm going to authenticate, because in the interest of time, I'm going to not authenticate. So I'm going to go back. And then what I've done is I've separated our databases from some government databases. And so the disaster lit database, which I don't think is going to be behind a paywall, behind our paywall. And if the authentication that I was just asked to do, if you're not authenticated through the Penn State system, some of the resources from the guide are not going to work until you actually authenticate. But Disaster Information Management Research Center, Disaster Lit is the NLM's kind of disaster medicine and public health database that's a subset of Medline and includes some other areas. And if we do, and I haven't done this search, so I'm not sure what we're going to find, but I'll stick to the search that we did in the databases, or in the Lion Search and in the catalog.
When he's searching for that, I'm just going to make one more point about the paywalls that he talked about.
Okay.
I had students ask in the past, like if I post the link to an article or the citation for an article, and they've said things about, they've asked about having to pay for the article. If we post something in a class, or if you're doing research for one of our classes, please make sure that, like, if you're using Google Scholar, and if you're starting there and you get to a journal that wants you to pay for an article, please go through our library. All of these things that he's showing you, like Penn State has subscriptions to, and as Andrew said at the very beginning, Penn State has one of the, what did you say, one of the top 10 research libraries in the world. So you don't need to be paying for articles. Use your Penn State login, go through the library, and if you go to Google Scholar first, just remember the citation and then find it again through the library. Do not pay for articles.
Jen, is that something that I could show everybody how to do? Would that be helpful?
Sure, go ahead.
Okay, I know we're short on time, but okay, so just back to the guide. There's a number of resources that I pay attention to. Disaster Lit, the Asper Tracy information gateway is fascinating. GovInfo gives you access to all government information. And so if you wanted to look at hearings from Congress or whatnot, GovInfo would be your place to turn to. Newspaper resources, I always include newspaper resources in any guides. Nexus Uni, Factiva, Newsbank, newspapers, you know, they all have different coverage. Newsbank is the best regional coverage in the US. Uni and Factiva complement each other on world coverage. The government information link on the guide, you know, goes from very basic CDC links to some specialized CDC links for emergency preparedness and response, and also resources for emergency health professionals. Some of these, there's a typo, some of these are actually collections of tools and networks specifically for professionals working in emergency health. You know, and so I tried to cover some different agencies. There's the Department of Transportation. Everybody's involved in disaster recovery or disaster planning, right? So there's a number of different links here that that I would encourage everybody to take a look at. Public health emergency is the HHS main kind of preparedness and response page. And then under state and local, some of you might be familiar with some of these. NACHO, the National Association of County and City Health Officials. I've included a directory of local health departments, and then FEMA state and local emergency information. That's an excellent resource. The state directory from the Homeland Security is also an excellent resource as well. So if there's some other resources that you folks know about that I've missed here, again, please feel free to share those with me at any time. Under gray lit, I've given a little bit of explanation about gray lit here. PH Partners is a collaboration of government agencies, and that's an excellent resource. Disaster Lit, another one. This National Information Center on Health Services Research and Healthcare Technology. You can do a think tank search here from the Harvard Kennedy School that will actually, it searches 1,200 think tanks and their research centers, which is really interesting. The evidence-based practice for public health portal from UMass Med School is a rabbit hole all unto itself, and so I would encourage you to, you know, some of these are really excellent resources. MetaLib is the Federated Search for all government information, so that actually you could go to MetaLib and do a search for a particular preparedness issue, and then see what the results are from different agencies. So it kind of breaks it down by agency where the results are coming from. And then I have there's an excellent Graylit resources from Tulane that I included as well. And so there's a number of other Graylit resources there. I've included some data resources, and the data resources are broken down by collection tools and in kind of guidelines for how to collect data or how data is collected for public health. In some cases, there's very specific guidelines. And then actually data itself. The Public Health Foundation train data is really good. The Public Health Partners includes data, and some of these you're going to see linked again. FEMA has some open data sets. Data.gov has some data sets that are in the realm of public health and preparedness. This Homeland Infrastructure Foundation level data is also interesting. And there's lots of other data out there, but I couldn't include it all. And then under organizations, Centers for Biosecurity from University of Pittsburgh, National Academies Forum has a kind of preparedness site. The WHO has a site. The UN has a site. The Public Health Foundation is an excellent resource for organizations. Relief Web is run from the UN Office of Coordination of Humanitarian Affairs. So, that's an overview of the organizations. So I would encourage everybody to kind of dive into the guide. Give me some feedback. Let me know what you think. And again, it's we're just about out of time, and that's quite a bit of information to give you. Consider the landscape of the literature when you go into any particular database. Don't try to find the best 3 or 4 articles right away and be done. Spend some time with those articles. Spend some time with the bibliographies. Think about those articles, and how they can lead you to more articles. Just on a real practical level, if I go back now to, I'm going to go to, Google Scholar, and I'm going to do Ebola and okay, so Ebola outbreak preparedness and prevention measures among healthcare providers in Saudi Arabia. And it looks like that the journal, it looks like, a lot of times these are going to link us. Yeah, it's going to download us the article, right? So those are fairly easy links to provide for your class. But something that's behind a paywall, it looks like Ebola, emergency preparedness and perceived response of Malaysian healthcare providers. So just to use this as an example, okay, and so it's American Journal. American Journal of Infection Control. And we don't really know, this get access here, or access through your institution. Okay, so institutional login. So what we're going to do is, American Journal of Infection Control, we're interested in December 2016. So what we want to do is, if you go to the library's main page, we could do it a couple different ways. We could take the title of the article and search the Federated Search. And it's first on the list. It says it's full text. And it's going to prompt me for a login. And it's important, and when we get to the end, it's important, and I'll show you why this is important when you do post something.
I do have a couple follow-on questions in the chat. So if anybody needs to drop off, go ahead.
Okay.
I'll post this and I will share the link. I'll share it on LinkedIn. I'll put it in my class. It'll go out to everybody. So I definitely don't want to rush what. So if you have to drop off, thanks for coming, and we'll see you next month. But Andrew, if you could, if you don't mind sticking around for a little bit longer and finishing what you were talking about.
No. There's a couple. I wanted to show everybody what a link to an article that's gonna work when you provide that link, and there's something embedded in the link that's going to be oh goodness, there's something embedded in the link that's going to be it's an easy access link that is going to authenticate somebody.
I didn't know you could skip that step.
Yes, I accidentally updated my whole operating system a few summers ago to horrible results. Okay, so if you, right, so this is the, so this would be the link that you would want to provide. And if you notice up here, you see this easy access libraries.psu. If you provide a link to an article that you found, like we found it on Google Scholar, you go to the Federated Search, you do a title search for it. If you go to the library's main page and click on the e-journals tab, and you could search by the title of the journal here and find it that way as well. But you want to see this easy access link, and that's going to allow, that's going to let the system know that you're a Penn State user. So, okay, so one other thing that I wanted to mention from the library's main page, if you click on subject guides, and when I click on subject guides, it's being a little bit slow.
Well, when it's thinking, if you want, I can, oh, there it goes.
There it is. And so when you get to the subject guides, there's a how-to section under the subject guides. So if, and on the how-to section, there's a number of things. If you wanted to look at, just from basic citation information, but then there's all kinds of guides about, data analytics and visualization, a data management toolkit. If I apply is a bias and resource credibility resource, data use agreements, and then Mendeley, and then Zotero. There's, Pennsylvania Data and Statistics how-to guide. There's a number of things. Survey design. So I would encourage everybody to, bookmark the library page and get to know what we have to offer. There's a tremendous amount of information, and when you start to use this early on in your time, you're really going to get the most out of it. So so the how-to guide, and then I guess the one other thing that I wanted to plug were the upcoming, there's some upcoming webinars, and and under, if you go to about and then news and events, and Jen, maybe I can send you this link to share with the class.
Definitely, thank you.
Yeah, so there's a number of events. If anyone's interested in the census, this proves to be a great talk here. But then introduction to data analytics and visual. This is actually an undergraduate. There's some undergraduate research events, but I think some of these events are also in line with early grad students. And so managing and organizing citations with Mendeley, there's a number of things. So so look at those events, consider those. I think you have to register beforehand, but that's kind of the other thing that I wanted to mention. So that's all I have. There's a lot. Does anyone have any questions? I'm going to drop that guide in the chat.
JD had two of them. He had to send a request through Iliad, because apparently Penn State doesn't have a subscription to the Journal of Emergency Management. So he's asking, one, how does that work? And two, how do we get Penn State to get a subscription that we don't have?
Okay, well, if there's a couple different, that's a great question. And so what I'm going to do is I'm going to share my screen again. Because that's one thing I did not mention. And if you go down to, there's a couple different, you're going to encounter, I would recommend going down to services and then going to interlibrary loan. And then creating an account with Iliad. Because then you'll have an account and have that account created. And so what you're gonna find is you're gonna come across an article that's not available in a full text format, and you're gonna see a button that says I want it, or request it, or fill out interlibrary loan request. There could be a number of different ways, but it's gonna clearly offer you the article, and it's not gonna want you to pay for the article. It's gonna be our link. And so when you start your searching, I guess it's very important that you're logged in and authenticated into Penn State, because that's gonna be a little bit more seamless. And if you've already created an Iliad account, once you're logged in, it's gonna auto-populate the request form and send it off. And pre-COVID, a request like Gene's could have taken a day and a half or 2 days. It might be a little bit longer now, because not all interlibrary loan is up and working at all libraries in all of the networks that we work with. The question about purchasing that journal or having that journal available, Gene, I think you had asked about a journal earlier, maybe a year or so ago, and I forget if that was the same title or not, but that's some collaboration that myself and the folks maybe at Harrow Health Sciences Library will have to work on. But those requests could come to me, and then I'm going to hopefully find some folks to help fund that. And I certainly, I think one of the things that I noticed is that I think we could probably have some more robust preparedness resources in our catalog. And so that's kind of one of the things that I noted when I was building the guide. I think we probably could find, there's some more material out there that we could buy. So any kinds of requests, whether it be books, ebooks, journals, you could request those to me, and I can do my best to fill those requests.
Great. So does anybody else have any questions for Andrew?
Hi, this is Jen. This is Gene.
Hi, Gene.
I would just say thanks, Andrew, for putting this together. It's really good. And then just sort of a request to everybody, if there are resources like books or subscriptions that you need for your work, either as faculty or students, please copy me on that as well, so that I can be in the loop and maybe help add some communications and emphasis to it. So just let me know too.
And I guess I'm looking in the chat here, so I guess it's hard to recreate what an Iliad request looks like, because we have access to so much. So when we do run into something that we don't have, it should prompt that kind of request. It's going to prompt a "I want it" button or "Get it at PSU," and then that's going to, it's really kind of a seamless. You'll get a text message or an email letting you know. And most of our interlibrary loan delivery is it's all electronic. So it's pretty impressive what they do. So by all means, if you find something that's not available full text, send for it. If you don't know how to do that or can't find that link, email me and I will help you to that end. And I guess the one other thing that I will mention is if you noticed on the library website, there's an Ask a Librarian button, a blue Ask a Librarian button that pops up and kind of comes and goes as you're searching. That is our chat service. That chat service is 8 a.m. to 10 p.m. weekdays. And then some pretty robust weekend hours. I work the chat. A number of other subject specialists work the chat. It looks like JD. Oh, okay. So you had the DOI plugged it in and populated the form. And so you used Ask JD and they sent you to Iliad, right? So, you know, we because we're remote, our Ask service is up 70%, I think, since the fall, from last fall. So it's very busy when we're on chat, but please visit chat, reach out to me, schedule an appointment with me. If you just want a more specific overview, we've got subject specialists that are better at searching Medline than I. There's a number of resources. Utilize us. We're, you know, one of the things I like to say is you know, the library and librarians, we're another resource, just like a book or a database or a guide or a faculty member. But we interact with you, and we want to make your research optimum. We want to save you time, and we want to teach you how to be the best you can be as far as your research projects go. So, any other questions? JD, thank you for sharing that experience. That's helpful.
So if anybody has a question and they want to say it, you can raise your hand. If you want to type it, go ahead and do that. Right now, I'm not seeing any of either. Give you like another second or two. So it doesn't look like we have any more questions, but Andrew, I want to say thank you so much again. This has been very, very helpful, and the guide that you put together is great. So I'm very excited about being able to share that with our students and them being able to use it. So thank you so much for all of the time that you put into that. And thank you very much
you're welcome.
for presenting it all.
No, I learned a lot. I really enjoyed learning, and there's some really excellent. There's some resources I didn't know existed that you can really kind of do some deep dives into. There's databases that provide incident reports, and I was getting into. There was an incident report about some chemical spill in Alabama. I forget the name of the chemical, but it's the chemical that they use to make propane smelly. And it smells like foul eggs, but there's, you know, there was this whole protocol on how to kind of deal with this very foul smelling, and it's not dangerous, but other than being flammable. But, you know, it's just really tremendous information that's out there for public health professionals and for emergencies and whatnot. So yeah, no, thank you.
Well, we definitely appreciate it. So